My name is Dr. Firas Al-Daher. I'm a family physician and I train at Western University. I did my medical training as well as my residency training at Western. And coming from a rural background, I've always was interested in practicing rural medicine. And Petrolia was the ideal opportunity for me. So I've been here now for 5 years. And I practice rural comprehensive medicine. So basically we look after all of our patients from the very young to the very old. And my practice is comprehensive in the sense that I do emergency medicine, I do inpatient hospital care, nursing homes, home visits, as well as clinic. I've been here for 5 years. It's been wonderful. And I have a wonderful team of colleagues who are young, very excited about teaching, and we could not be happier to be part of the Western Family Medicine Department under their umbrella so that we can hopefully train further rural family physicians. They can expect that they're going to have a young core of physicians training them in many aspects of rural family medicine. So there's emergency medicine, there's procedures, but there's also advantages as opposed to, and I feel I may be a little bit biased about this, but versus the urban family training. So as advantageous as that is, here out in Petrolia, we take a lot of pride and a lot of effort into teaching our residents and giving them some form of independence as well. So they see their own patients, they do their own follow-ups. But at the same time, they have the luxury and the capability of following up with us. We have a very collegial relationship. We don't treat the residents as students per se. We treat them as physicians. We respect them as physicians. And our patients have come to respect and love the role that they play here. So the other big advantage of the Petrolia site is that we encourage the residents to pursue their own interests. One of our residents is pursuing an interest in palliative care. Another one is pursuing an interest in emergency medicine. And since all of the physicians here have their own niche and their own practice interests, they can spend more time and do more rotations or electives or shifts, if you will, pursuing that which interests them so that when they're out in practice, not only do they have their core family clinic, but the interests that they've developed and they've loved to pursue while they were training here.
And I'm a PGY1 in family medicine in Petrolia. Just started the first couple of months of rural medicine here in Petrolia. So far it's been really great. The preceptors are all really keen to teach, and it's a varied practice. So there's emergency medicine, clinics, nursing home, and really just great variety. I was attracted to rural medicine because I always had difficulty deciding what I liked best. And the great thing about working rurally is that you never do have to decide. So if you like family medicine, but you also enjoy procedures and emergency work, then you kind of have it all here.
A lot of their rotations are also in Sarnia, which is a secondary teaching site. And the nice thing about Sarnia is that they get to experience community medicine in the sense that it's not an academic center per se, but there's a lot of one-on-one teaching, one-on-one procedures, and our residents are loving that. A lot of the positive feedback centers on being very active in first year with ICU rotations, with emergency medicine rotations, obstetrics, pediatrics. They are getting to the opportunity, the experience to be very active without having senior residents in an academic center, unfortunately, taking that experience away. So they're coming out of those rotations feeling much more confident, with a lot more skills, a lot more experience, and a lot more knowledge.
Western makes the experience easy for students who are practicing outside of London. So there's the opportunity to webcast for the academic half days, and I've also gone back to London a couple of times, and so far it's been not an issue.
To be affiliated with Western and the options and the freedom and independence that we give to our residents to pursue their options, to practice comprehensive care, to be affiliated with very enthusiastic and very talented faculty is an advantage on its own. Petrolia offers an additional advantage to practice procedures, to practice comprehensive care, to be very directly involved, and to have an independence that I think is unparalleled anywhere else. So you're going to be fortunate to be part of the Western Family Medicine program, but you're going to find that Petrolia particularly offers you opportunities that may not be found anywhere else.